There's that button.
Well, what's the problem now?
Oh, nothing. Just setting it up so I can actually write down your information. Oh, okay. Oh, why did it go to full screen? All right. So last we left our heroes. So you were in Japan. God, what was the last part we talked about? I remember all the injuries were coming in.
Okay, the triaging and the hooches. Then we were getting too many very seriously ill who could not be put there. They needed to be put into a very special unit, separated from the hospital, because we don't know what they came in with. So we got the worst of the casualties. Most of them stayed overnight, except those that couldn't be moved. And then on Tuesdays or Wednesdays, we would be alerted that the burn flight is coming in. So
I assume that's what it sounds like.
Oh, it is. It's from tank burns, mostly tank burns. They would come in, of course, and of course, they had these massive silver nitrate dressings on. This was before the other stuff came out. They were so bloated, they had the biggest endotracheal tube you could find, and it was in their trachea, so they could breathe. So they did a tracheostomy on them. And we would just take care of them, and the next day they'd be transferred to Camp Zama, which is the Army hospital. So we could watch the severes. Some stayed with us for a while. And then what else? Yeah, you weren't supposed to be on that unit for more than a year because of the PTSD that goes with it. I was fortunate enough that I was on it for 2 years.
Yikes. Okay.
Well, I liked it. So, you're a young troop. You're doing your job. I wish I had the knowledge I have now accumulated in a while. But that year there, they gave excellent care, would transfer them. Then I got orders. Oh, this is interesting. I wanted to apply to anesthesia residence.
Right. That's it. So this is still in Japan?
Yes. So I go to this commander from Texas was the reassignment person, and I get called there, and she tells me that you're in PACAF, Pacific Command, and I can't apply for schools till I get to the States. And that's when I said, well, may I have San Antonio? She in turn looked at me and said, you'll go where I tell you, with that attitude.
Wow, nice lady.
Oh, I'm not finished yet. I don't do well when people talk to me like that. I said, thank you. And guess who turns out to be the chief nurse of the Air Force? The very same nurse that was my chief nurse that I used to give report every morning to. And she had to be the nicest, tall, slender, loved men, that's for sure. But any favors I'd ask, like when the kids were born, she'd tell me, go. I said, when should I come back? She'd say, you'll know when to come back. So guilt would take me and make sure mom was okay and come back. And then she gets reassigned to Washington, D.C. as the chief nurse of the Air Force.
Oh, nice.
What? She gets promoted to general. First general nurse that had become a general. I dash off a letter to her and told her exactly what the colonel said and told her it doesn't make sense. If I'm going to apply for anesthesia school, why are you sending me to Goodfellow, which was in the upper desert of Texas? I said, it makes no sense because after I apply, you're going to have to move me from there back to San Antonio. Why don't we kill two birds with one stone? So I wrote General Heffley. Within a few days, I get a Twix. All orders are canceled. You will report to Lackland Air Force Base. Well,
Wow.
how that other chief felt well not to be outdone. I come to Texas. I have to report to the chief nurse of the medical facility. Guess who's the chief nurse?
It was her again?
Her again.
Oh my God. And she didn't think to mention this when you wrote her?
All she knows is her her orders were canceled. So she was, you have to report to them, hello, and all this shit. And she says, why haven't you gotten your paperwork for anesthesia school yet? I said, huh? He said, well, General Heffley just called me and wanted me to tell you to get your paperwork in immediately. Okay, so I did. A class goes by, and then I'm waiting. Meantime, I'm doing medical surgical. Then I got transferred to the operating room, recovery room, and intensive care. And then the colonel of the anesthesia school, Colonel Bakutis, I get her name right there, Alice. She was an old maid, crazy in the hoot owl, had her PhD in chemistry. Now, she was a terror, but we got through it. And then, then I did, not finished. Colonel Bakutis comes running into the intensive care unit, which is attached to recovery room. So I used to do both. And she says, why haven't you submitted your paper to school yet? The general just called me and wants to know why you weren't accepted. I said, I did submit my paperwork. I didn't know to follow through. Well, guess she had to follow through. My paperwork was on some sergeant's desk in New Jersey.
What?
Not finished. They faxed it immediately to the assignment bureau, or whatever they call them. And they have already gotten their quota of 5 students. They don't take any more than X amount. Well, they had to change the rules. I was put in.
Oh my God. Wow.
It's what you know. It's who you know sometimes.
I hope you wrote her a thank you card.
Well, no, but she'll always be delved in your memory. After that, I was assigned to Westover Air Force Base. The reason I was assigned to Westover Base is I sent a note to the general. Now, some poor bastard of an anesthetist has only been there 6 months. and he can't figure out why are they transferring him.
Oops.
I didn't heard. And from there, I did general anesthesia for whatever I did. Then I resigned. Did I resign from? Yeah. The only reason I resigned is you guys had no home to identify other than the base you were at. And I'm going, they don't have any roots to stand by. And I would check, see around. And these guys, kids are going off to college and I never see them again because they go live in another state. Because all their assignments, they found a state they liked. And I thought about that and I said, no. That isn't why we got children. They need roots, so I resigned. And I loved the service. Very much so. However, you have to look at your priorities. My priorities was you and the kids. You and mom and the kids. You know what I'm fucking talking about.
Well, if it helps.
Yeah.
It definitely helped the family cohesion. It obviously made a difference in our lives.
Oh, of course you had. Let's not even talk about teenage lives around here. But they at least had a stable life. Stable parents. We weren't that crazy yet. We were getting there.
So, I mean, so we went from Westover and then you left the Air Force. Is that when you moved to Beverly or was there an interim place? Didn't you guys have a place in Salem first?
Dick Willett called me. Remember, I had no thoughts of resigning at that time. I guess I did. Well, he calls me and says, we need an anesthetist in Gloucester. And I said, oh, why? He says, well, the Gloucester guy just resigned. He's joining the Air Force. And I'm thinking, I interviewed that guy. Now, this guy thought I was taking his job, which I was, but yeah, I didn't know that this was.
Wow, what a coincidence.
Oh, I tell you, the world gets smaller. I worked at Addison Gilbert Hospital. I enjoyed every minute as a young grad. The chief of anesthesia, well, Dr. David, God bless him. He was an alcoholic.
All right. I mean, but at this point, you are a CRNA.
Yes, I passed my boards. Oh yeah, we had to go to Boston for that. It was for a whole day or a day and a half, whatever. I remember once at a break, everybody's around talking about some of the questions that were answered. Now I'm feeling like a dummy here. I didn't answer their questions. I'm going, I got depressed. I wouldn't go with them for another break because I must have flunked. I didn't answer what they did. Well, lo and behold, it was between Dale Salisbury, my classmate, and me, who got the highest grades.
So they actually got it wrong, and you got it right.
I'm thinking, how many of them flunked? You're allowed to take it at that time 2 or 3 times. And if you still don't pass, you have to go back to do your residency.
Yikes. Yeah, I'm not scared for PA school at all now.
Well, there's a lot of politics involved, but you kind of flow with them. And what else? Then I worked there, and then I went to Lowell General, Mr. Harrington, worked there.
That's funny. I might actually do some work there because it's right next to school.
Yes, I worked at Lowell General for 3 years. And I was getting very unhappy. Um, the chief of anesthesia was a Korean and nutty Korean. We would fight all the time. I wouldn't take anything from him. And the day I was decided, I got to get out of here because I'm unhappy, and I'm sure I must have shown it at home. So I'm going to resign. I have my resignation papers, which is very short and brief. And he's avoiding me because he knows I chew him out if whatever gets me going. So what he does is, you don't know the configuration yet, he goes around to go to the restroom. And I know he's trying to avoid me. So I wait outside the restroom. He said, let's go sit down a minute. Okay, you sit down. And I said, before I say anything, if you say one word, I will walk out now. Not in 2 weeks from now, but now. Is that understood, doctor? And then I moved to the VA, I think. To the VA in Jamaica Plain.
Oh, so that's when you went to Jamaica Plain. All right.
We had a very incompetent chief of anesthesia. The anesthesia department was basically run by the surgical department, if you want to believe that. Dr. Mahler was born in a hospital and lived in a hospital his whole life. He was married, his wife was no kids. His expertise was pharmacy. He knew his drugs very well. That's about all I can say. But there was no discipline in our department. None. You could sense it, like, oh, come on, be a boss, will you? We'd have meetings once a week and nobody's really paying attention to him. He's not really enforcing it. I said, oh, God. Then I got accused of a cardiac arrest. And that's what cinched it. So, yeah, you did your regular stuff. And then I had to go to a mortality meeting. And it's all the big cheeses, even from other VAs sometimes.
Yeah, don't you have to defend yourself, your actions?
Oh, yeah, but it's like you went to an inquisition. And they accused me, and then I stood up and said, I don't know how to break the news to you, but I am a CRNA. There were 5 physicians in that room. They were in charge of CPR. My job was strictly to keep the patient aerated and give what drugs necessary. So they go to use the paddles. They're not even plugged in. So now we keep going. Well, anyways, I finally stood up and said, I know what you're doing, and I don't like it.
They're trying to scapegoat you.
I am not the one to blame. I go to give the patient some epinephrine. Dr. Mahler, not Mahler, that other one, I'll tell you about her. She discontinues it, and I'm sort of overruled because he's my supervisor. Well, anyways, the patient died. And that's what I said. I said, I really wasn't in charge. My supervisor was right there. So anyways, I got an official reprimand. It didn't matter. I resigned. And lo and behold, then I went to Malden. I enjoyed that. Another chief who was the biggest asshole you'll ever meet. Now he's going to go into private practice at Jake's. Now he hasn't given or administered anesthesia in years. So guess who has to be his teacher? He had to watch me do an induction. Then the next one he had, this is what I dealt with. The nurses were great. I had this Indian doctor who was a crook. When I resigned, they said, well, why are you leaving? I said, well, it's finances. The pay's not moving here. I get a better job. And she says, well, we're willing to give you this amount. I said, no, that's not enough.
I love it when they match you and it's like, so why didn't you give that to me before?
Yeah, that goes in my head. Well, when what happened on that interview? Oh, I went for the interview not wanting the job. Honest to God. So they said, well, we give 2 weeks vacations for your first year, then 3 weeks vacation. And I'm going, sir, I've been in anesthesia I don't know how many years. I've been getting 4 weeks vacation, and that's really what I want. If you can't give it to me, no problem. I'm trying to get out of this fucking job. And then, remember, I had professional burnout twice. That ain't going to happen again. So he says, well, then you have overnight call, and then you stay for the morning or till you're discharged. And I went, no. If I'm going to work all night, I'm going to go home. I am not staying for another shift. And I said, I've been through that game before, and it ain't going to happen again. He makes a freaking concession.
Never know till you ask, right?
How can I not take the job?
Wait, but where was this interview? Because you were at Malden before, right? Or is this
No, this was after the VA. I went to Malden.
Oh, so this is the Malden interview.
After Malden, I went to the VA, yeah.
Okay.
Well, I just had to go back to tell you about this asshole.
Okay.
He used to get his prostate exam in the cysto room. He'd come out with the gloves and call the urologist, and we'd all look at each other. He was also guilty, but I couldn't do. You do a little physical before there. If you suspect anything, well, he would always check the women with an open hand and a stethoscope there. That's how we would check their heart.
Wow. He'd be like fired immediately nowadays.
I know. Well, anyways, he was left to Anna Jakes. I have no idea what happened to him, but I can assure you, I wouldn't let him touch me or anybody I know. Okay, let's move on. Lowell General. There, how's that go?
Well, General, VA, Malden.
Salem Hospital.
So now Salem Hospital, did you work there 2 times then, or is this the only? Because I remember you didn't take the job at Salem Hospital originally because you hated the conditions.
Oh yeah, their pay. You remember? It was an insult. I couldn't believe those CRNAs, and it isn't that they sat on their ass. They were worked a full 8 hours every case. And I'm going, nah, nah, nah. And the chief of anesthesia, oh yeah, I remember. He sits there and, like the big chef he is, little do they realize, unless I respect you, I'm not going to be very nice to you if you're not nice to me. And so he's a little arrogant, and he starts telling me about the glories and what the pay is. And I was in shock when he said it. And I literally closed the interview. I said, I'm sorry, doctor, but I'm too expensive for you. And I walked out.
I wonder if that, I'd love to do a wish I knew what he thought about, or, how his reaction was,
Probably swore at me in his mind, I guess. I don't know. Well, then where did I go after that? Well, I went to somewhere, and then Gus worked at Salem Hospital. He called me that there's an opening there. Oh, I know what I did. I stopped anesthesia. I had a full-blown counseling practice.
What? I didn't know you ever stopped.
Yep. Because I'm trying to think, what did I do? I didn't go to any other hospital. So my practice was doing very well. And Gus calls me about that opening, and I'm thinking, I better get back into it, at least part-time. Because you stay out of this too long, you're not going to go back. You trust me, you won't. You'd be too scared. So I go there, get an interview by one of the most nicest people I've ever met in my whole life, the chief of anesthesia, Dr. Slater. And I look at him and said, "You're Dr. Slater?" And he looks at me and said, "Yeah." I says, "Well, believe it or not, I've heard of you for years because you were at Lynn Union and nobody would leave because of you."
Oh, that's great.
"Yeah, so I wanted to meet you, doctor." So we talked, and he hired me right on the spot. So I went up and did some paperwork, I guess, and you should see what I got. I was a temp. I was for myself. So my contract was, they paid me per hour or per day. Call pay, vacation time, 401k that they contribute half into. What else did I get? I'm in shock over the whole thing, All I wanted was a part-time job.
Health insurance?
Oh, total coverage. Dental, mental, physical.
As a
whatever.
temp?
That's how good I was.
That's very unusual. Wow.
Well, I know, but it really happened. So he gets me, I said, Doc, I can only work 3 days a week because of my practice. He said, okay. Within 2 weeks, he had me full-time. This son of a bitch.
Well, if you've got some time.
Yeah, we could use you, but he was a tough guy to say no to. If you go,
you got to watch out for the nice ones. You don't want to disappoint him.
I forgot you'd go to him with a problem, and he would look at you and says, "Well, take care of it." Okay.
Oh, I like that.
I must say, a very good staff to work with. You know, they were, except for one female, but she finally left.
I swear there's always one, even in the best staffs.
She had to be the rudest, crudest, egotistical female you ever met. And you can imagine what happened when he divorced her. We had to live with the crying and the. Finally, she left and went to work in Boston, which was to our relief. And then I did, all the surgeries, big surgeries, minor surgeries, brains and all that shit. And then I noticed nobody liked doing locals, especially for eyes. It's a totally different procedure now, but then was, and so I'm going, well, I've been, I'm thinking, let the young people take over the big kids. I've done them all. So I decided, wondering, what's their fear? Well, I understood why. So you would give them a shot of penthol, and they would do a periorbital block or just an orbital block. One of the docs, I forgot his name, he was the chief of eyes, would take, I think, a 10 cc syringe, it looked like a 20, get it there and force it in. I mean, just, and if the patient moved, he'd be all upset. Can you imagine? So I started sneaking in some fentanyl. And he told me he didn't want fentanyl. I figured that's not his right to tell me. It worked. And then the other cases were easier to handle. And at that time now I'm learning to master sedation. And that actually became my specialty. I remember the chief, Dr. Salt, what a wonderful guy, he calls me into this case. The patient's on this big orthopedic frame getting hit, but we can't anesthetize him, general. Couldn't give him the spinal because of the medicine, whatever. He says, well, can you sedate him? Get him comfortable. Well, this guy was really brittle. Did a marvelous job. Guy pulled through fine. And so whenever cases like that would come up, he'd give it to me. But I mastered it in day surgery, which I was okay with. I was ready to. But I actually organized it. And Steve Cormier, remember Steve?
Oh, yeah. Can't forget Steve.
Yeah, he died of a heart attack right in front of me. Boom. Well, anyways, he used to do eyes. In between cases, we would be wasting 45 minutes to an hour while he's setting up. And I'm going nuts because this is wasted time. I'm just standing here waiting. So I go report this to my boss saying, or the chief. Oh, I knew the chief of the surgical suite. As a matter of fact, we both retired the same day. We were both the same age. I go up to him and tell him, because they always putting you through time studies. How long does it take you to do this and that and that? And I said, well, Steve is taking 45 minutes at least between cases. What he's doing, he's flipping around, you got all these cases for the intraocular lenses. I don't know what he'd be doing, but he's just busy. So guess what rule it is? Once I have my patient settled, and in the recovery, which was daycare recovery. I go prepare my patient and go to the room. At first, he was in shock. Well, I didn't call you. I said, you can forget that, Steve. You're never going to call me. This is how we're going to do this all the time now. The minute I leave and get my other patient, we're coming in. We will notify you that we're coming in, but we're not going to wait for you to notify us. So now it's becoming streamlined. We can do 8 cases a day. That, believe me, is exhausting. And so it's smoothened out. It's amazing how when you kick somebody in the ass for them to move, but he's always like that, slow. So that morning next morning, I go to the locker room and we're changing. I'm actually just maybe a foot away or 2 feet away from him. And then he goes, oh, boom, ooh. I call a code. Everybody came in, they did the CPR. So, okay, he never pulled through.
Yeah, you said I remember you saying they worked for like an hour and a half or more trying to revive him.
Trying to be about an hour. In a bathroom. In the locker room. Which the bathroom was over.
And this was the day. Was this actually the day after he had to hurry to get everything ready for surgery?
No. That's already.
Okay, just totally unrelated. Got it.
Now, to hear a little gossip, his marriage was going downhill. He wasn't. He was pitting his new daughter against his stepdaughter. The guy is a fucking counselor with his master's degree. He comes up to me and asked me how my marriage survived, because he knew the turmoil I put myself through. And I'm going, well, it's time to compromise and go see a counselor if you have to. I did. Oh, I think he was trying to find an easy solution. Then I'm finding all this. He would come home and take his earpiece off. I mean, you want to see somebody who's real ugly. Now there he is on his earpiece doing his treadmill stuff. Well, communication broke down. She divorced him. And of course, I suspect the stress of that, because he never controlled his emotions in the first place. So, Steve is gone. It's sort of like no big loss for me, because there's more to the story than you even want to hear. So lo and behold, what happens? I get my heart attack. I don't know when. The time element is gone now. I survive. I have to go for rehab. And I work in the operating room, so I'd have to ask an hour from that. They didn't like that. Would you believe? I had to go to rehab. I mean, I went. Who's the head nurse there? His former wife. And she's scared I don't like her.
And that makes perfect sense with what you've said about if he pitted his 2 daughters against each other, the wife would just assume that he was bad-mouthing her.
Whatever. He never bad-mouthed her in front of me.
Well, I didn't say that he did. I'm just saying she's probably assumed that.
Yeah, whatever be the case. So I looked at her and said, she said, gee, I'm sorry. She said, You sure you want me to care for you? I looked at her and I said, I see no reason why you shouldn't care for me. I really do like you. What happened in your marriage is none of my business. It makes no judgment to you. So I go on the treadmill and she's, I put your EKGs and all that. Now I'm throwing PVCs up the gazoo. And I had to stop because I could see it there. She saw it too. I started crying. I just started crying. I didn't expect that to happen, I guess. I don't know. She comforted me. And then it never happened after that.
Well, I mean, you had been through quite a bit. It's good that you actually let it out.
Well, I didn't plan it. It just clean. Okay, let's move on. What are we doing now?
Okay, that's great.
Cool.
So it's asking about calendar years, but I mean, you covered, let's see, so that had to be what, 1961 was when you started, maybe?
Started what? I started nursing in 1960.
Oh, I was so close. So nursing in 1960. So your CNA training was when you came back to Texas. So that had to be what, 68?
66.
We were in Texas in 66?
Had to be. I graduated in 79, I think.
Oh, I didn't know you had been there for so long. I thought you were only there a couple of years.
We were there for 3. January 71. That's when the residencies would rotate.
6, 7, 8, 9, 10.
Trust me, I'll get it on the wall.
You says 71. You said you got there in 66. That's 4 to 5 years.
I didn't say 56. What was the question? I'll clarify.
When did you start anesthesia school? What year?
68.
Okay. But you arrived in Texas 2 years before that.
Yes.
Right, and that was the whole delay. Okay. It all fitting together now. All right. So, and when did you officially pass the boards?
Had to be in 71.
Okay, so same year. All right, so you passed the board in 71. So at that point, up until retirement, what year was your retirement?
What?
You retired when you were 60.
No, 59.
Oh, pardon me.
Well, it makes a difference because I bought my own insurance.
Oh,
and
that's
that
right.
cost me $600 a month.
It cost us $1,300.
I was okay with it.
All right, so you're 59. All right.
Then I resumed my counseling practice.
All right.
Not heavy. I didn't want it heavy. I worked my whole life. You have no idea how many jobs I had at once. It was stupid. I cursed myself for it.
In between the donut shop and anesthesia.
I was going to college.
And counseling, going to college.
All in one whack, together.
And you had a heart attack at 55?
Yep. At that time, statistically, most anesthesia personnel would get heart attacks around 55.
Well, that's good. Yeah, you fit that number perfectly.
I said, oh my, you've got to be kidding me.
All right. So now we're getting into more of the direct questions. So what it can be over the entire span. It can be a specific job, your last job. But so what was rewarding, or what did you consider most rewarding about your job?
That I was able to calm patients and relax them for it could be a strained, ripped finger, but that to them is major surgery. And it's frightening. So to go in and I'd give them some Versed, I'd relax, I'd talk to them first, of course, because I had to have them sign a paper, the anesthesia paper, and do a mini exam because they already had one.
How does anesthesia affect you? And like, well, it puts me to sleep.
Well, I told you that story, didn't I?
No.
Really? Yeah, I can picture the guy right now. Oh, yeah, Pentothal will do that to you. Of course, we got more drugs better than Pentothal, propofol. And what else do you need to know?
All right. So now,
The ability, especially if I have a woman who had an abortion, miscarriage. I'm using a medical term. Having a miscarriage, they're mostly all just broken apart. And nurses usually don't approach that type of death and fear. I can tell you from experience, I'll have to observe. So I'd sit down with them and have a little talk and try to comfort them and tell them, you know what? You now have an angel that's going to be looking over you the rest of your life. I would like you to give this child a name. Be it a boy or a girl, we don't know probably. And you're going to do fine. And they would come right down, then I'd have them sign them. So that in itself would make you feel good. Plus, I did a lot of eyes. So these people, were all in their 70s, 80s, and 90s, deaf and addicts. And I'd have to prepare them to take their teeth out and ear stuff. And you'd see some conditions like the hygiene was horrible. They were supposed to be cared for. So I would joke a lot with them, try to make them feel good. And before we went into the operating room, they were out like a light. They'll wake up and not realize they just had their surgery.
Perfect. That's what most people want.
Yeah, one of the docs, he was at the going away party. His wife was having hand surgery for the third time. And he asked if I could be her anesthetist. All you have to do is request it. It goes in the book. And so I do her, get her to recovery. She thought next to Jesus I was the best she's ever had. Never felt anything, never felt anxious. So things like that kind of make you feel good. Yeah.
Cool. All right. So here's the $1 million question. What were some of the hazards of your job? And when I say hazards, I don't mean toward the patients. I mean to you.
With stress. This, I don't know if I want to call you grow up with this stress in your job. It's automatic. So you're always on guard. Did I ever tell you my prayer would say, I'd get out of my car and walk to the hospital, bless myself and say, "Dear Lord, do not allow me to harm anyone due to my negligence." Every day, said it like clockwork.
That's a good idea. It keeps it at the forefront of your mind.
Yeah. But it's that I didn't realize all this stress was part of my life, because it's part of your life. I mean, it's like you chewing gum. You kind of get used to it. About a year later, something happened. It felt like 1,000 pounds was off my shoulders. I'm telling you exactly how I felt. And I'm going, oh, it's over. I realized that was from my job.
So you're saying after retirement is about a year later, suddenly the stress was gone?
It finally calmed down.
Did you have any, I mean, there's obviously equipment accidents happen. Were there any type of at-work accidents that could have happened?
Technologically, you mean?
Dropping a scalpel on your foot, anything.
Well, your aides dropping the patient, not paying attention. So that didn't happen with me. They were not allowed in the room till I called them in. Because once I was in the old part of the old ICU, surgery center. And what they did is the minute the case was closed, the nurse is stripping the room, the orderlies come in, nobody's paying attention, and I'm with my patient. I was in trouble. I'm having trouble getting out. I had to take my foot, put it over the patient's arm to hold it. Nightmare. Turned out okay. From that point on, you will not take the trash out. No orderly will come in till I call them. And you think of it as, this is authority that I really don't have. But I assumed so much authority that it never was questioned. That's the advantage of getting old. And really, you know what's going on. And taking control, because if something happens, you're the one to blame, not them.
Yeah, I get that. I mean, the reactions that I have when I question my teachers now, if I had asked them some of those same questions when I was still in my 20s,
Yeah.
Oh, they take me seriously now.
Yeah, that's the difference. So anyways, certain things you just smoothen out. I was fortunate enough that the senior staff backed me up. I don't know if they backed me up or not, but they never said anything. Like I told you about my lunch times.
I don't remember your lunch times.
Well, this is a goodie. They would give you lunch if you're lucky. I'd call in and relieve me at 1 o'clock. By then I'm so hungry I could eat the sole of my shoe. So I'm starting to get irritated. And I spoke to the doctor there, whom I love. I said, this cannot be. I am here at 6:30 in the morning, getting my work ready. Maybe I'll have a cup of coffee. By noontime, I am hungry. And I get grouchy. He said, okay, well, guess what? They kept repeating it. So you know what I did? Or if there's time to eat or around that time, I roll my patient to recovery room. go to the head nurse who's running the schedule and say, I'm going to lunch. She said, you can't. I said, watch me. I go to lunch. Because what happened, I'd go into the lounge to eat. Within 5 minutes, they'd come in and say, hey, when you finish, could you take it? I thought, this is no lunch. So I'd go to the cafeteria to avoid that. And we had pagers then, or beepers, I don't know. It would go off. Click. I would stay a few minutes longer, probably 10 minutes longer. They even once had the audacity to page me on the PA system. No fear. Didn't answer. I went up. Nothing was said. And I continued the practice. I had to. I mean, if you don't take care of yourself, I realize their responsibilities. They have to run a schedule and push and push.
I talk to nurses all the time who are still dealing with that problem.
Yeah, well, that's the way it is. But you learn to take control. That's all. Next.
All right. So did you ever become injured or ill as a result of working on your job? I mean,
Well,
did you actually contribute?
it was about a heart attack.
Well, okay, yeah. That's from the stressor.
I got a ruptured appendix at that time. Yeah, that was a goodie. That's a funny story. Then obviously my chest surgery, and I've had a killer procedure, medial meniscectomy, 2 endarterectomies, plus the bypass. As we go up, 2 hernias, bilateral hernias, then my lungs. I may have, then my finger. Oh my God, that was a bitch.
Lay a finger.
Oh, I had a good plastic surgeon. She was my patient that night that I injured myself.
Oops.
She wrote me out an antibiotic because you couldn't see anything really. She said, if it swells up, come to the office. I mean, so she changed I got antibiotic change 3 times now. Then she would do a digital block. Oh, that really hurt. Then she opened it right up, exposed the whole nerve, had to scrape it. I wasn't feeling the pain.
Well, thank God.
Then they had to leave it open for primary closure. So she gave me, I had some sulfur type ointment, cream, wrap it, and would go, I don't know, maybe once a week that would change it. And sutures. But she blocked me. Oh, I get the creeps just thinking about it 3 times to clean up the wound.
Wow. Well, I mean, it was obviously necessary. That's not a block you want to wear off.
Well, then it finally healed, but I don't have feeling at the tip of this finger. It's weird. I can feel it hitting me, but I can't feel this part of it. And she said,
I have nerve damage here, so this is...
Oh, yeah. So she said, okay, well, why don't we go back in and I'll strip it. I'm not that crazy. Thank you. I'm going to leave it alone. I'll live with it.
Thanks, but no thanks.
Yeah.
But how did you get tuberculosis? I mean, I know you come back positive, but it's not active tuberculosis?
Tuberculosis, you mean?
Tuberculosis, it's late. I haven't
No,
had dinner.
I'm not being critical. I want to make, you're not saying it right, so it took a
So
guess.
tuberculosis. Sorry, you got it though.
Okay. Yeah, I kind of figured that was checked out when I was in Texas. I was admitted to the hospital with dehydration. And I had already run a positive PPD. So upon further study, they found this mass. By the way, it's still there. So they were debating on, I had to go in front of the medical committee. They're debating, half debated that I should go on medications. The other half said leave it alone. I decided, I read about the INH and all that shit. I went on, unless I have to take this medication, right now I won't take it. So I didn't. I suspected I got it when I was a nursing student in Lynn, where people would come in with the diagnosis. And of course, these no precautions were taken. Me blowing, coughing right in your face as you're trying to get sputum samples. Well, that's what it was.
Well, that actually
That's
qualifies as a work injury.
It's the only place I could have gotten it. Yeah, that is the only place I could have gotten it. I'm a carrier, but not active. So.
All right. So there was nothing that you ever had to report, though, except when they had to deal with that. If there was,
don't give me any PPD tests and all that.
right. But as if something happened at almost any of these jobs, was there a labor union representative? I mean, there wasn't a union ever really. I mean, there's just who would you report to if you had a work injury?
To the hospital. Or to my department, because my department was separate from the hospital. And I am covered with medical insurance, with any type of insurance. So that would fall on the anesthesia department.
All right.
Because they're under contract from the hospital to the hospital, whatever it is.
Awesome. That actually covers all the questions I had, because we've covered everything else, maybe in a roundabout way, but no, that's it. I got everything.
Well, as you know, I'll check my social schedule to make sure you don't call me when I'm busy. I did have a very busy day today, so I'm so glad.
Yeah, actually, it's busy for me too.
Whole pile of useless things, but I kept me busy.